Yeah, I said no and stop on several occasions, but that didn't seem to matter to him.
A sexual assault victim shares her horrific story for the first time to spread the message that no victim is ever to blame, but also to ask a question when it comes to collecting evidence after their attack. Is there a gaping hole in healthcare?
I think it's been a gap that has existed for a long period of time. I know that medical professionals are not real comfortable with these kinds of cases.
Well, after a sexual assault, the most important thing for a victim is to get medical help.
Another important step is collecting whatever evidence there might be. But as Nick Monticelli reports, there appears to be a lack of training in that evidence collection.
But there could be a fix coming from Oakland University.
Think of this as a solution they wish they never had to come up with, but it will help the victims of sexual assault, child abuse, or elder abuse. And while Oakland University is the one putting on the program, it is the hospitals that are most excited because their patients are going to benefit.
Okay, tell us all about it.
Everyone knows children can cause commotion.
Hey, bud, you want to go in here?
But it is a good thing because Kristen Zwang could use the distraction. Last year, a stranger came into her apartment and sexually assaulted her in her own bedroom.
I said no and stop on several occasions, but that didn't seem to matter to him.
After the attack, Zwang went to an emergency room, but there was no forensic examiner there, no one to collect evidence. She was told to go elsewhere.
I just put myself out there, and told somebody what happened to me. And there's no one there, I'm going home. I'll deal with it or whatever.
The lack of forensic specialists is no surprise to those inside of hospitals.
How many of the 10 blades do you have in here?
At Crittenton Hospital in Rochester, Dr. David Bauer is the chief of the emergency department. This is not where Zwang went for help, but this is one ER where doctors are not afraid to be honest, admitting when it comes to sexual assault and evidence collection, not everyone has the proper training.
This is not something that's in our wheelhouse. These are more legal aspects that, quite honestly, we're not trained officially in handling some of these things.
This would be our typical evidence kit.
Fortunately, there is a solution. Turning Point, an agency that offers counseling, shelter, and more for abuse victims. They also have trained forensic nurses meeting with victims in their Clinton Township or St. Clair Shores offices.
I think this is a better environment. These cases should not be seen in the ER. There's just not the time.
But while they do great work, there are not enough of them to do it.
So we're just going to spend a couple minutes going over the syllabus, and if you have
that is where Oakland University comes in with a brand new forensic nursing program. Kelly Berishaj is the coordinator. It is the only program like it in the entire state and one of only a handful across the country.
Forensic nursing is not part of the education that nurses receive. So having this program where nurses can receive advanced specialized education is a must because they're not going to get it any other way.
The first year of the program was a success. Now, more and more nurses will have this training helping put away sex offenders. It is a nurse just like this
Bubbles everywhere.
That met with Kristen Zwang. Her fiance convinced her to meet with a Turning Point forensic nurse who found DNA.
For my nipples and also my vagina, they had to do swabs.
And that DNA pointed to her neighbor and also linked him to other cases. He will spend the next 75 years in prison, thanks to Kristen's courage and a forensic nurse.
Afterwards, you can breathe. There's a little bit of relief there because you know that it's finally over. You might not forget it, but the point is you went through with it. You did everything you had to do.
In Rochester, Nick Monticelli, Local 4.
What a courageous young woman.
Yeah, we really appreciate her sharing the story. There are enough roadblocks that keep women from taking those steps, and to think that there is no point in it at all, in the end anyway, is just a horrendous one. Yeah.